just to kick things off, could you give us a little bit of an introduction to yourself in terms of everything you are doing at the minute? You're so busy.
I'm Thorrun Govind. I'm chair of the Royal Pharmaceutical Society's English Pharmacy Board. I am a practicing community pharmacist, and I'm also a lawyer. So yeah, quite a few hats that I wear. I qualified in 2016. I do a lot of media work as well, so regular sorts of things on BBC, Sky, and also in print as well. So a few strings to my bow, which keep me busy. But yeah, it's great to be along with you guys today and have a chat with you.
How did you actually get into pharmacy in the first place? Was it something that you'd always wanted to study in university, or what actually got you interested in it?
Well, in terms of pharmacy, I think we're really accessible on the high street, and I always thought it was sort of a bit of a mix, really, because your doctor, you'd have to make an appointment to see, but you could go and see your pharmacist, no problem, really accessible, and I just think it's great for the hub of the communities that community pharmacies are, really. And it's been absolutely fantastic over the years. I've worked in a number of different community pharmacy settings to really get to know the patients and the differing clientele, really. So sometimes I've worked in pharmacies where all I seemed to do was measure up compression hosiery, and other pharmacies where all I seemed to do was advise on childhood illnesses, Calpol, you name it, it was going out the door, advising on those typical childhood illnesses. So I think I've had a really mixed experience of pharmacy so far, which has been really fantastic.
You've already talked about you have a number of strings to your bow, so I understand that you've recently qualified as a solicitor as well. Congratulations. So what actually made you add that string to your bow, because it's a little bit different from a typical pharmacy career?
Absolutely. So I've always had an interest in law, so big fan of the MEP, medicines, ethics and practice. So the ability really to just study outside of pharmacy was really interesting to me. One of the first cases that I looked at was actually regarding boots, regarding where exactly a sale was taking place. So really, really interesting. And I guess I always think about law and pharmacy go quite well together, because when we're at work, we are in our pharmacies, we actually are thinking about the law, but we have to have an understanding of the patient in front of us, and sometimes we do break the law in the best interest of the patients, and that's where the documentation comes in and making sure that you are able to justify your decisions. So at the moment I support healthcare professionals with legal matters, which makes it even more important here to offer some advice to your listeners in terms of that documentation is so important, and making sure as well that if you are contacted about legal proceedings, for example, that you don't just bury your head in the sand. If you get that sometimes and it won't go away, it's likely that you'll just get another contact from the court or the lawyers to ask you to do what you're asked to do in the first place, and sometimes just reacting early and providing that information can really help through the course of some of those proceedings that I deal with.
So you're incredibly busy now as a fully trained solicitor and also working in pharmacy as well. So I suppose it's a bit of a buzzword at the minute, particularly after COVID and everything like that. Everyone's talking about this work-life balance and everything like that. How is it that you're juggling everything? How are you finding it? How is it that you do it all?
I think I do it all, and I'm really lucky that I have a lot of support around me, so that's really key. I definitely couldn't do what I do if I didn't have support around me that I do. I think also the fact that I absolutely love pharmacy and love law, so everything to me is pretty much enjoyable. Obviously there's aspects of any role that you don't are going to be particularly difficult or challenging, but I think I have a lot of career satisfaction, and that's what's been really key to me throughout, I think, everything that I've done. I just think if I don't enjoy something, I'm not going to waste my time trying to force myself to like it. And I guess I've been quite lucky because I quite like what I do.
That shows that you enjoy what you do, because we have been doing our research on you, and you're you're very well awarded woman as well. I can see that you've won Young Pharmacist of the Year and the Pharmacy Champion Award. But like for you personally, what would you consider to be your best or the achievement that you're most proud of professionally?
So professionally, there was a patient who I wasn't doing a medicines use review with. They come into the pharmacy, and after chatting, I've realised that they stopped taking the last medication they've been prescribed when they've been prescribed a new one, and obviously it was for hypertension. So for some of those, you obviously need to make sure you carry on taking them because we're going down that algorithm. So we had a chat, and they were exhibiting some symptoms, which highlighted to me that perhaps they weren't taking their medication properly. And therefore we had a chat with the doctor, I liaised with the doctor, and then I was able to come back and really they saw the doctor, got a prescription, we were able to provide them with what they needed, and that was amazing. Another interaction was regarding mental health, and obviously this week's Mental Health Awareness Week, so just having the ability to speak to someone in a consultation room and for them to trust me with what was going on in their life, those are probably the biggest things that have really made an impact on me, because it's exactly why we do what we do, and exactly why they need to keep funding us in pharmacy, to keep doing this, because where else would these patients go?
Well, you're exactly right, and just as you said, it's very much a privilege to get to help people in those situations as well. So brilliant achievement all around. I suppose on the flip side of that, you talked about the different achievements that you've had during your career. What would you say were some of the biggest challenges that you faced along the way, and how did you actually overcome them whenever you were met with them?
So I think my age has been an issue to some people, because I was the youngest elected board member at the Pharmaceutical Society. I'm the youngest chair that they've had. So I think some people are always going to have a problem with you in some ways. You can't please everyone. So I think realising that has been the biggest thing to me. I'm not here to please everyone. I'm about doing what's right and doing what's best for the profession. So that's what keeps me going. So I think it's perhaps recognising the difficulties that you have, but also it spurs me on when people criticise me, to be honest. So I think it's just this ability to continue is probably one of my strengths, which sort of is on the flip of some of the difficulties that I've had.
What did your journey look like in order to get there? Because as you said, you're a very young person and to be in this position. So tell us a little bit about what that actually means to be chair, and then also how it was that you got there.
Okay, so I've been advocating for pharmacy in healthcare and the media for over 10 years now. So I would contact journalists, speak to them, explain about what pharmacists do, what they do to benefit their communities, and that's been something of my own initiative. Not got paid for doing so, absolutely just my own time, I spend time quite late at night, sometimes contacting journalists, I still do it now. So I spend a lot of time doing that, and over the years I think that's been recognised within the profession. So in 2018 I stood for election to the Royal Pharmaceutical Society and was elected onto the board, and then I was re-elected and then elected as chair. So I think it's been an amazing journey for me. I'm also someone who thinks let's make the most of opportunities, let's make the most of opportunities for pharmacy. So I've had some amazing opportunities to go to Parliament and advocate for pharmacy, healthcare, the ability to go on Sky News, go on BBC. So whenever I get the opportunity, I'll always talk about pharmacy. I think people recognise that, and they also know that I have an appreciation of what it's like on the front line. It's not easy. It's definitely got more difficult, especially year-on-year funding cuts. There's not been a benefit to the profession, and I also know that we need to upskill pharmacists and allow them to develop their careers. So I think quite a big supporter of pharmacist prescribers as well. So I think generally I want to uplift the profession with everything that we do, and that's been what's really important to me. I think that's been probably part of that journey as well.
100%. That's really interesting, and it's so good to have someone like yourself being such a voice of the pharmacy community as well. So I've had a bit of a creep on some of your socials, and I recently saw that you met Prince Charles. Was it recently? So that was really exciting. But what would a typical day look for you? Like, would it always be hanging about with the royals, or?
I wish it was, no, but we have to do some real work. So it can be a bit of a mix depending on what's going on that week. But obviously, some of the things I'm having to deal with now in the pharmacy are some of the shortages we're having to deal with. So HRT shortages, which we've been speaking on the news about recently. I do advocate for the team to have a break. So like making sure that we get our lunch breaks in is so important as well. And obviously some of the law work that I do, depending on the days that I'm doing. So I do have quite a mixed week, but what I do get to do is I think have a bit more autonomy over what I do, which is what I really appreciate. I think probably that's one of the benefits of being a locum as well, isn't it? For many people, they want that ability to be flexible with their work week. And I've done the whole working 21 days in a row, 30 days in a row in my time, and I definitely wouldn't recommend that because we all need to have a break. So I don't think I do have a typical work day, unfortunately, or rather fortunately for me, because I think that works really well for me.
Yes, no, definitely. Variety adds a bit of spice to life and everything like that as well. So you touched on there that you've recently had an awful lot of coverage in the news all about the HRT shortages and everything like that. So obviously your presence in social and in the media is so important, and it's arguably helped you get to where you are today. So any younger pharmacists or even pharmacists who are in the career who are sort of thinking about starting their journey on social or engaging with the media a wee bit more, what advice would you have?
I think it's really important to have a social media presence in this day and age. You are a brand, so if you're a locum, for example, if you are showing those attributes of being a fantastic locum, that's a great way for people to know about what you do, and to develop your sort of professionalism online. So that's definitely something I would support. I think the most important tip that I've probably lived for and encourage others to think about is that don't write anything that you wouldn't want your grandma to read. I think it's the best thing, really the best advice, because obviously we are aware, you've got a social media presence, and GPHC obviously has a duty to make sure that we are not putting the profession in disrepute. So I think we've all got a duty to act as an ambassador for the profession, and also to make sure that we're behaving professionally. And I think that professionalism that we can exhibit collectively will do wonders for the profession.
And as we're filming this, it's sort of coming up into mid-May, so we've got an awful lot of people gearing up for the pre-reg exams and everything like that. So you've mentioned yourself as well that you have locums before and you have done your work in community pharmacy. So for any pre-regs watching, could you give a wee bit of an overview of what it actually is like to work in community pharmacy?
Well, I think it's quite varied. So it can be anything from getting involved in dispensing as a foundation pharmacist, to looking at drug interactions, to answering the obscure query that your pharmacist will give to you. They want you to have a look first. It could be measuring compression hosiery. It could be liaising with local GP surgery and chasing up on items. It could be just sitting down with a patient and listening to them in the consultation room. So I think it's really varied. I think my top tip for those who are foundation pharmacists is obviously it's a marathon, not a sprint. So you want to be learning throughout your year rather than and you will be learning at work, but I think just don't put too much pressure on yourselves. It is a long time, it's a whole year, so you need to make sure you have those breaks and get some rest in, because it's not a nice exam to do, let's be honest. It's no exams are nice, are they? I'm definitely not an exam person, I'm definitely more of a coursework person, but I think just to look after yourself, you've got to make sure you get those key things in when you're just starting out as well, because they're going to help protect you when you qualify as well.
There's so many different roles that you can go into with pharmacy, some slightly more left field than the others. You've got your clinical roles, your hospital, your community roles, For anybody who's now newly qualified or looking to actually begin their working career as in full-time roles, what sort of would be the key things that you would recommend they take into consideration when they're choosing what pathway to go down?
I think the fantastic thing right now is you can have a portfolio career, so you don't need to make a choice too early, and have the opportunity to be prescribing pharmacists in GP practice who work in community pharmacy. So actually, I think right now you don't have to worry that you're making one choice and that's what you're going to do for the rest of your life. I think it benefits the profession to have people moving between sectors, because then you have an understanding of what it's like in that environment, which can support your colleagues in that sector.
Just to sort of round up our questions today, if you could send yourself back in time and speak to a young Thorrun whenever she was sitting her pre-reg exam, what would sort of be the number one tip that you would give, whether it's to do with studying or stress or just managing your own mental health? What would be your number one tip?
I think that's such a difficult one because I'm a worrier naturally, but I think to tell myself not to worry doesn't necessarily work, because I think that keeps me going. You know, they say don't you with stress, like there's a certain level which gets you to be motivated, and it's when you go over the curve and you're at the other side that it's too high basically. So I think I would just say enjoy it a bit more, because I'm definitely a worrier. So enjoy the process of pre-reg. Don't be in a rush to qualify, because you need to also, you've got so much to learn during that year, and take your time.